everyone. We will go ahead and get started. Just a reminder for everyone that we are recording this session and will be placed on the website with the other resources that we have available to you for the CAP. I'll start with a few updates. I'll share my screen here. Really not a lot of new updates, just some reminders of some of the upcoming dates that we have available to all of you for any sort of TA conversations that we want to have moving forward. Again, same format as some general updates, questions. This morning, we'll be going through the survey portal very quickly. Just for those of you who have not seen it yet, just give you an idea what to expect because it is much longer and more encompassing than the crisis survey, but it's the same platform, it's the same software that we used for the previous crisis services section of the CAP. And then we'll open it up for any general questions. The portal demonstration may take a few more minutes longer, so hopefully I'm going to try to be able to leave about 15, 20 minutes left for questions. But if after that time, I'm willing to extend it to answer any questions that may be remaining or one-on-one conversations as needed. So some general updates. Again, remaining office hours. Our next scheduled office hour will be Wednesday, January 4th. Again, we'll bring up the survey portal, answer any questions that anybody may have about any difficulties maneuvering that. And then we'll review the annual update requirements. And then Wednesday, January 11th, if needed. So we'll make the decision there on the 4th. So just kind of pencil in January 11th. I haven't set that out as a formal invitation yet. And we'll decide then on the 4th whether that session is going to be needed or not. So at least one more opportunity, possibly two. We still are working with HPIO. They're in the process developing a toolkit around smart objectives and the indicator menu, similar to what they did provided on the equity side of the CAP. We're doing the same thing, developing a toolkit for the smart objectives and indicator menu. That'll be available to you before the end of the month, and we will send that out once we have that approved. They're also assisting us with 2 more webinars. We have one scheduled for next Tuesday, a recap of the smart objectives and data collection demonstration, recap of the smart objectives, and then a data collection demonstration. We're going to be visiting several secondary data sources, showing you how to get access for those, potentially for long-term performance measurement activities. So we'll have that available to you, and then Thursday, December 12th, or excuse me, Thursday, January 12th, from 10 to 11, open discussion, questions and answers for that one. Knowing that it's kind of crunch time, we're going to open up for any sort of conversation you want to have about the CAP, and we'll try to answer any questions that you may have. Specifically about the webinar for December 20th, and I said that that's actually Wednesday, it's actually Tuesday. We again will be going over recap the outcomes and indicators, and then also data collection. So we'll be revisiting some of the standardized indicator menu to develop smart objectives. We'll provide some additional examples. We heard some feedback from those of you who attended that webinar that more specific examples would be welcome. So we'll be able to do that. And hopefully you'll be able to equip and prepare to compile data from secondary sources to measure progress over time. Then one thing we talked about earlier this week that we thought would be a great idea would be to provide an opportunity for live feedback on choosing some outcome indicators. So if you're kind of stuck, you would like some advice, we'll take a few minutes to answer any questions that you may have about choosing an outcome indicator based on the strategies that you are thinking of across that crisis, or excuse me, across the continuum of care. So we'll have the opportunity to answer any questions that you may have about the difficulty, or maybe just get some advice on choosing some outcome indicators. So that's a brand new segment we're going to add to that webinar. So look forward to that. Again, for those of you, I know it's getting close to the holidays. For those of you taking time off, this will be recorded and placed on our website to be used for future revisiting. One more note, the revised CAP guidance document was posted on our website. We sent that out last week as well. That is located in the same section with other CAP documentation. So for those of you who did not get it previously, we did revise it. We updated a few things. We kind of modified some language for some additional clarity. And then we've fixed a few of the examples that we provided to you. So that is on our website. We sent that out last week as well. So for those of you who have problems accessing that, please let me know and we'll get you that documentation. So that's all the updates that I have for you this morning before we kind of go into the survey portal overview. Any questions anybody has? I will throw this out there. Received quite a few questions, and at the end of the month, we will, for those of you who are looking at it and using it, we'll update this on our FAQ documentation as well. We've had quite a number of questions come in around the plan section. And okay, we have the continuum of care that we are requesting for you to identify your top priorities across the continuum. Multiple questions coming in from multiple where we're saying, what if we have more than one strategy that we want to work on? The CAP only requires one, and that's the most pressing strategy against your most pressing priority against the continuum. But if you have more than one, our guidance has been, if you want to include the multiple priorities, multiple strategies across the continuum, include those on the template. And when you email in your additional documentation for your service inventory spreadsheet and your completed signature page, if you or any other ancillary documentation, whether that be through a needs assessment, strategic plan, whatever it is, you can send that to the QPR board docs email address that's included in our guidance for submission for the service inventory and the spreadsheet, the service inventory spreadsheet and the signature page. You can include the templates with that and say, please see template for additional strategies that we would like to have included in our CAP. And we will add that on the back end. We only allowed for one across the continuum, but if you have more than one that you would like to include, put it on the template, email the template to us and say you want it included in your CAP. So just to answer a few of those questions that have come in, it's perfect. It's great that you have additional strategies that you would like to include, and additional priorities you want to include as well. Please feel free to share those with us and we will get those included in your CAP on the back end. And then we'll discuss internally about making that available in the next round, so 2026 through 2028. So we'll look at that as well. Any other additional questions? Okay, if not, then we will move forward with the demonstration of the survey portal. Okay, so each of you have received a link specific to your board's CAP survey. And this information, at least the first two, will be pre-populated for you. So for this demonstration, we had Montgomery County and then Ms. Helen Jones Kelly, the director of the executive director of Montgomery County's board. So this will be pre-populated based on the link that we provided it to you. Just for this example, we chose Montgomery County. So again, this will follow along with the templates that we provided to you. Again, we recommend that you utilize the templates to capture this information on the assessment and the plan prior to getting into this and starting entering in this data. So you can cut and paste where necessary, but at least have that on paper as then you progress through the survey. So the first question here within the portal is mental health and addiction challenges. So the first question 3 has to do with children, youth, and families, and we're asking you to identify minimal, moderate, and major challenges across these areas which we've also identified. So you just go through and it's just clicking radio buttons based upon where you're at as far as minimal, moderate, or major challenges across all of these indicators. And then there's an opportunity for you to provide other. So you can type this in, and I'll just use this as a demonstration. That this will then pre-populate into the next page. So you have the opportunity to hit save on any page, or just go to the next button and it saves automatically for you, and you can revisit it later. So as you saw, the other that we typed in here, you can also choose minimal, moderate, or major, and then you just add that as well. So the next question is to select the top 3 challenges for children, youth, and families in your board area. And again, you can also choose the other that you included in the previous page. So then we ask you to examine that question for adults. So just hit the radio buttons. We will not add in the other for this one, and you will see that it won't pre-populate to the next page. So we ask you to identify the top 3 challenges for adults in your board area. So this is the disparity section for mental health and addiction challenges. So we're asking you to, based on the assessment findings, which of the following groups are experiencing the worst service gaps or access challenges in your community? You can choose all that apply. We'll just choose one here. So refugees or English language learners. So here you have question 10, the optional disparities narrative. This is not a requirement. This is just an open text box for you to use if you so choose. The same thing with additional assessment findings for mental health and addiction challenges. These 2 boxes will be provided to you for each section of the assessment. So if you have specific disparities narrative that you want to have specific to mental health and addiction challenges, or the next section gaps in services, you can include that specifically in each of these sections. And again, down here, there's opportunities for you to expand this. So if you are cutting and pasting directly from your template and you don't see all of it, you can expand this box until you see everything. Maybe there's a couple of typos or grammatical things that you want to clear up. You have the opportunity to do that as well. So hit the next page. And then we move on to then looking at service gaps in the continuum of care. What are your biggest service gaps and access challenges? Again, the same format. You have radio buttons to identify minimal, moderate, or major for each one of these. And I'll leave one of these unchecked, and I'll show you what you'll see in the next page here. And again, there's opportunities to identify other. So if you just happen to miss one of these, it's not going to let you move forward. It'll bracket some red lines to show you the information, the required information that is missing. And it could be, we have a lot of radio buttons here. You just could have missed it. It'll bring you back to that page. You choose one, and it'll then allow you to move forward. So again, the top 3 service gaps. And then we have access for children, youth, and families. And again, opportunities to add additional if required, if necessary. Access, top 3 gaps, and then access for adults. Let's go down through here. And again, I'll just put this in here to show you as a demonstration that this will then pop up on the next page, and you can choose the level of challenge that's provided to you. And then again, it's also included as one of your potential top 3 gaps. And again, then you have disparities information. So, so service gaps and access challenges. Again, the same disparities narrative, open text opportunity to provide information and additional assessment findings. So then the next section is the social determinants of health. So identifying your drivers. So this is questions specifically asking you, based on the assessment findings, describe the extent to which the following factors are driving mental health and addiction challenges in your community. Specific to question 24 is social and economic environments. So 3 choices: not a driver or unknown, moderate or major. And I'll just choose these. And again, there's an opportunity to add other. So of those, the top 3 that you choose. And now we move on to physical environment and health behaviors. And then your top 3. And again, the disparities information based on this assessment finding, which of the following groups are most affected by these social determinants in your community. And again, opportunities to add additional narrative through disparities or additional assessment findings. So moving on with the assessments, here's the section where you identify your strengths, including community assets and partnerships. We ask you to choose 3, and there's an opportunity for here to add other. And if one of those others is chosen, we just ask you to enter in what that information is. Here's where we ask you about your level of collaboration with potential community partners. Here are the definitions that we provided to you, just in case you need to see them again. These are the same definitions that are on the template. Here's the list of partners. Again, no interaction at all, networking, cooperation, coordination, collaboration, and this entity does not exist. You could have multiple levels of relationship with the same provider. We just ask you to identify the highest level of collaboration that you may have amongst that community partner. So you may be working with the local school districts in a variety of ways, but the highest level that you have in any one project is collaboration. So we just ask you to do that. Again, these are just radio buttons. You work your way through. So, and if we missed a partner that you have, you can identify again as other, and then it'll pop up on the next page. I think I got them all. If not, it'll tell me. Hey, we did. So the next question is then indicate the relationship the board has with community behavioral health providers. Question 36. Again, these questions are different than what it is. The question numbers are different than what it is on this survey platform versus the templates that we provided to you. That is because each of these opportunities to add information is considered an opportunity for a question. So as you'll see towards the end of this, I think it's like question 200 or something. Rest assured, there's not 200 questions. It's just the opportunity for you to add information across the platform. So this first one is to identify the number of providers across the behavioral continuum that the boards are aware of within its area. And this is just strictly a number. So this is the universe of providers that you're aware of. And question 37 asks, of that universe, how many MOUs, higher levels of collaboration via written format that you may have. So you could be aware that there's 8 prevention. I'm just adding some numbers in here because it is just strictly adding numbers. We're not asking you to identify the providers. We're just asking you how many you are aware of in the universe of the continuum. And then again, how many of those of you who are partnering with by evidence of a former memorandum of understanding or other former agreement. So of the 8, say you're partnering with half of those. Mental health, you're doing 10. So whatever it is, this number needs to be. And then there's an optional link to other community assessments. You can link to any other regional community assessments that are relevant to your board, such as your community health department's community health assessment or hospital community needs assessment. If that is available online and is published somewhere, you can just add in the link to that text and we will review it. If not, if it's a formal document, You can share that with us with the QPR Board Docs email address that you do with the other resources that you're sending to us. So that was the end of, and it's very subtle, that was the end of the assessments. So now we're going into the plan. So it describes the language here. This is a second of three sections of the CAP templates. The plan section of the template will be serving as the board's 23 to 25 community plan. So the question here is describe how your community plan applies to the service area by your board, either a single county or multi-county, and the plan covers all counties together. As it says on the template, and as we discussed last week, if you would like to submit a plan on behalf of every county within your board area, please contact me and we'll walk through that process to submit that information. It is different. The way that this survey template is set up is that you're either a single county board or a multi-county board that you're submitting a single plan on behalf of all counties. So this is the only option you have with this. If you have the need to submit multiple plans across multiple counties, please let us know and we'll walk you through that process. So here's where we identify the priorities. So the continuum of care. As we said previously, the template provides this information in a table format. That's not conducive to the survey platform. So each of the categories within the continuum of care has its own page, and that'll become more apparent as we walk through this. So the first of the continuum is the prevention. So we're asking you to add in the strategy to indicate the service program or policy change that you implement. So what I will do here is I will just fill this prevention section out so you get an idea of what it looks like. So I will just use the prevention example that we provided on the template for you. So I just cut and paste. I have this template on a separate screen, and I just cut and paste from that template. So the age group that we included the 13 to 17 age group and the 14 to 25, the transition age youth, and then the priority populations and groups experiencing disparities. So in this example, we utilize residents of rural areas, and then the general community. It's just the general community program. So the strategy I included is universal school-based suicide awareness and education program in the 4 districts, the 2 age groups that we provided, and the outcome indicator that we identified for this was linked use suicide deaths. So again, I'm just copying and pasting from the template that we had, and there you go. So we hit next, and then up pops the next segment, and it's mental health treatment. So we're going to do the exact same thing for all of these. And I will just kind of go through this to get through this, because if I don't do this, and you'll see it here, you will have to go right back and enter in that information. So we'll go through this really quickly. So this is substance use disorder treatment. The next section is MAT. Crisis services. So we do have a specific question for crisis services that's not included in the others, and that is here, question 60. Please identify the next steps and strategies to improve and enhance your crisis continuum. Are there other strategies that will be continued other than the ones identified above? So we're asking your top priority across the crisis services category, but if there's any other additional information, and this could just be the same information that you included in your final question on the crisis service survey, or if there's been updated information since you submitted that, please include that here in question 60. Again, it's a simple copy and paste if there hasn't been any new information. Next is harm reduction. recovery supports. And here's where the two special populations come in. So pregnant women with substance use disorder, one of the special populations. The other is youth through the crisis continuum. We added youth on the prevention side. So just a reminder of that. That's spelled out in the guidance and on the template as well. And here's the second special population, parents with substance use disorder with dependent children. I will go back. Another question with these two specific populations, since they are special populations, if there are any other priority populations or group experiencing disparities, you can include that here. I do know a few of the boards, we had conversations that with pregnant women with SUD, you're potentially dealing with African-American Black women for this, so you can identify that as such. If you do not have an additional special population with this, you do not have to choose one. So as we pointed out in the guidance, that some of this will then pre-populate moving forward. So these outcome indicators are provided to you. These are pre-populated based on what we just filled out. So this was the indicator that we chosen for prevention. So use suicide deaths. This just then pops into this as a way to remind you, so you don't have to kind of go back and forth. So you can see that each of the ones that we added in here are then moved forward. So then this next section is then asking you to identify the additional information on your priority population, your data source, your baseline year, your target year, and your target. Again, I will just use the information that we included on the template. So the priority population, again, is youth. And you can add the specific age groups, you can copy and paste. So the data source that we had included in the example is ODH vital statistics. I can type, I promise. So the baseline year was 2018. That baseline data was a rate of 4.0. The target year is going to be 2025, and we hope to reduce that by 1%. So this is then, if you're following along with your template, this is page 5, pages 4 and 5. So your SMART objectives. Again, if you want to, just copy and paste. Just be prepared that this goes down rather than across. Again, this was just the way that we had to provide this in the survey platform. So as you can see in the tables on 4 and 5 of the template, it goes across, this goes down. So just be aware if you do copy and paste that you move down and not across. So again, we'll just add some text here. And we'll need to do this across each of the continuum categories. So put next and up pops MAT and crisis services. Again, this goes down rather than across on the table. And again, as you see in the bottom right-hand corner of these, here's the lines that you can expand these if you want to see text that kind of gets blocked out because of the text dialog box is bigger. You can adjust that as needed. Here's our final, again, you can see the outcome indicators that we entered in. Here's the final continuum category of recovery supports. And here are the two special populations for pregnant women with SUD and then parents with SUD and dependent children. Okay. So that really completes the two tables on your template. So then we move on to the additional opportunities for you to add information on collective impact to address social determinants of health. So For the next 3 questions, please select the top 3 partners for your board area, collective impact to address social determinants of health. This is a drop-down menu. So this then refers back to the collective impact section that you want to look at. So here's some potential partners, and I'll just use this as an example. So say we want to look at having something to do with addressing the social determinants of health that have an impact on youth suicide. So we want to work with educational service centers. Again, these are completely optional. You can choose to bypass this if you want to. This moves on to the next section. If you do add something here, it then brings up an additional set of questions. So what are you going to be working on with your educational service centers to address youth suicide? What is that strategy? So are you going to increase training for your district's teachers, increase training for your district social workers or guidance counselors, whatever it is that may be? You type in this information. Any additional key partners that you want to include with the educational service centers, and then priority populations that you're looking at specific to this. So this could just be a general community program that you're going to do. And again, the outcome that you want to use to address and measure your progress over time. If this, and we'll go back and I'll take this out. If you do not choose anything here, then this just goes on to the next section, which will be a different set of numbers. So we jump right now to question 146. So again, additional SMART objectives for priority populations and in groups experiencing disparities. So we ask you to identify your top priority populations and groups. So you could potentially look at Hispanic residents. Again, this pops open a brand new set of questions. So we're asking you to identify your outcome indicator, your data source, baseline year, the same thing that you did previously, and we've added a notes section. Again, if you choose not to do this and you leave these blank, it then moves on to the next question. The next question is other community plan requirements, and those of hospital services. Looking at, again, question 173, describe any child service needs resulting from finalized dispute resolution process with the County Family and Children First Councils. Again, this is open text, and you can expand it down here if you so choose. Again, describe your collaboration with county FCFCs to serve, high need multi-service youth, multi-system youth. And again, describe your collaboration with your county FCFCs to reduce out-of-home placements. Excuse me. Question 176. Again, this is 176 questions. They're just multiple opportunities for you to add information in these boxes. So I will add in stuff here, and you won't be able to progress through if you don't. Identify how future outpatient treatment recovery needs are identified for current inpatient and private or state hospital individuals who are transitioning back to the community. How is that process? What does that process look like? Identify what challenges, if any, are being experienced in this area. So there's others here. If you aren't experiencing any issues, there's an NA for not applicable. If there are challenges, they're not listed here. Again, you can choose other, and please describe what that challenge may be. And then explain what the board is attempting to do to address those challenges. With the next button. And then here are, again, the optional sections of the CAP. Data collection and progress report plan. Again, not required. If you're developing a plan to collect data on how to then report on your success measures, your outcome indicators that you'll be reporting on for your annual updates. You can choose to include that information. If not, it's optional. A link to the board's strategic plan. If you want to share that information, it's posted online on your board's website. Just link to that plan here if you want to choose it. Again, if it's a paper document, you don't have it on your website, please include that in the QPR board docs, and we'll talk about that here in a minute. And then link to other community plans if you so choose. So this is page 32 of page 32. As we talked about before, you have the opportunity to save at the end of each page, progressing forward, and we'll show it here. You hit the back button, and all that information that we entered in is still there. Is saved automatically. And if you're having issues with that, please let us know. But there's opportunities to save. You can go the next button, or you can hit the save button. You can print this out if you so choose. If you want to have a copy of what you submitted to make sure that there's no discrepancies moving forward, you can print that, and it'll print out this in a board text. It's up to you, no requirement to do so. You can also hit the save button if you want to be extra special cautious. What I will caution you on is do not hit the submit button unless you're absolutely sure you're ready to submit. Since this is much larger than the crisis services survey for the legislative requirements section, this is going to be extremely difficult for us to modify moving forward. So if you accidentally hit submit, it's going to be difficult for us to be able to recover the data in any usable format. What we'll probably do is we'll send you a new link to then resubmit that entire information. So please don't hit that submit button until you're absolutely ready. And then once you are, then that locks that survey. You can't access it anymore. If you want a copy, you can print it. You can, if you want a copy, you can utilize the templates and do that. What we will be doing is once these are approved, we'll be taking your information out of this survey platform and putting it into a template and then sending that template to you. So that's a template you can use to show what your CAP looks like to your stakeholders, to your boards, whoever it is that may want to have access to that, your county commissioners, whoever. We'll put that into a template and we'll provide that to you. And that template will be what's put on our website for future review. The auditor of state looks at that to make sure that the requirements are being met on behalf of the board and on behalf of the department of posting those. So we have to put something on our website that shows this is your community plan, and we'll provide that template for you. You can use it as you need to, and then we will use it to put on our website. So the only other button down here that we haven't talked about is if this may become, and I'll go back there. It may become useful to you, especially when you're hitting all the radio buttons for the collaboration, or then your minimal, moderate, or major challenges. This little reset button. Go back here. So if I could get to it faster. Or say you messed up the numbers, and you've miscounted or you missed a number. You just hit this reset button at the end, and it resets the data that you included on that page only. So you can see that the information is here on the previous pages, but it just resets the information on this page. So if you just happen to mess up, and I know that these your eyes kind of go crossed a little bit when looking at all these radio buttons and making sure that all these are accounted for. If you mess up, you can reset it and you can do it all over again. But it does keep what you've saved previously. So you can come back and revisit that. So that's it. That's just a kind of a brief overview of the survey platform. So it does look a bit different from the templates that we've been serving, or we've provided to you, and we've been discussing in these office hours. But that's just due to the necessity of us being able to use that platform. Any questions on the portal?
Chad, I have a question. Well, a couple observations. One, when I went to the online link given to us for our board, I noticed that you cannot move through the online survey without fully completing each page. Mm-hmm. So if I just want to move on to look at the next pages, can I just put whatever I want on a page with a note to myself to go back and change that later.
Yeah, and that's where we ask you to utilize the templates and then the guidance document, because we do that one-to-one crosswalk between the templates and the survey. So we've included the specific question numbers that correspond between the template and the survey. So that hopefully would minimize the need to be able to do that. And that's why we do ask you to complete the templates first. But yes, if you just want to do exactly what I did to move through to make sure that you have all the information that you're going to need prior to submission, yes, you could do exactly what I did and move through it. Just don't hit the submit button at the end.
Okay, and then you talked about that all the questions are listed like in the template. I think like under the plan section and things, that there's like a block of questions listed.
Mhm.
What I was wondering is there a document that lists each of the questions, question 1 through question 182, that like just in a row on a document that I could then, I'm thinking of like, so I could put into a spreadsheet and answer each of those questions so that I kind of know before I go into each of the pages.
No, we have not created anything like that.
Okay.
No, we're hoping that, and if you're having issues with the template and seeing what information goes where, please let us know. We can have that conversation to you. But that's all the information that you need to include in the survey can be included on that template. But if you're having issues with that, please let us know. But no, we did not go through 1 through 187 to map out each of the questions individually.
Okay.
And again, it's not 187 questions, so there's just 187 opportunities for you to include information. So really that templates that we provided to you, I think there's maybe a grand total of maybe 11 questions, 6 questions on the template. But again, extrapolate that opportunity to add information across the continuum. It increases that number, that question number, exponentially within the survey platform.
Sure, and I get that. I was just, when I'm looking at like the assessment document, and then I look at the online, like the page 2 or whatever. I see like on my assessment document, I have major challenge, moderate challenge, minimal challenge. And then it's in reverse order when I go to the online document, and I realize that I'm looking at ways to keep myself from making errors as I'm trying to add information quickly. So, but that's fine. I could create my own document.
Okay.
Thanks.
Chad, this is Robin in Seneca, Ottawa, Sandusky, and Wyandotte counties. I'm just wondering if you have the template completed and want to maneuver from page to page, is there a quicker way to go from like page 1 to page 20 without going to the next button and having to scroll down on each page?
No, it just goes sequentially.
Are we frozen? Are we working? Chad,
Yeah.
You're frozen on my screen.
No, I'm still here.
Okay, well, this is John from Trumbull. I had a question about question 177, which is sort of at the end, about hospital challenges.
Yes.
The original template just said a drop-down list would be provided, but it wasn't there. And I don't see it in the guidance document either. Am I missing it?
I'm not sure, but we can clarify what those drop-down choices are.
I think I had the same thing with, can't even read my own notes now. with another page, but that's one of those things where it'd be nice to see the question before we get there on the data entry process.
Sure,
See.
and we can clarify that, yes.
I don't know what my other question was, but if I think of it, I'll get back to you.
Sure, not a problem. Any other questions? Specifically about the portal?
Hey, Chad, this is Phil Stone from Lucas. Am I incorrect saying that I thought there was supposed to be something about community or community plan or capital plan? I'm sorry, in the portal too, or no?
No, so our folks at Capital Planning will provide you with information starting in January about what that process is going to look like. We just asked you to kind of, as maybe a precursor to that conversation, if you had any capital needs that were attached to strategies that you are identifying within your CAP, just to kind of keep those in the back of your mind as then that capital request process starts in January. But we're not requiring you to include any information on the CAP itself.
Okay, perfect. Thank you.
You're welcome. Any other questions? All right, if not, I will stop the recording. I will keep the line open until noon, or if longer, if we're having some really good conversation. But if not, that will end our session for today. And then we will see you at the next one in January. Just a reminder that we have our next webinar scheduled for Tuesday, the 20th. And then we will recap SMART objectives, outcome indicators, and the due data demonstration as part of that webinar. And again, this and that will be recorded and placed on our website. If there are no other questions, I will stop the recording. And then I hope everyone has a